Hello and welcome back to Long COVID MD. I'm your host, Dr. Zeest Khan. I was a full-time physician for 10 years, taking care of critically ill patients. But in 2020, I fell ill with COVID, and since then, I've been a full-time patient struggling with the symptoms of long COVID. In this podcast, I share my journey and my expertise as a physician and my experience as a patient. In today's episode, I'd like to offer an explanation of some medical titles. There are a lot of specialists in medicine, either by title or self-proclaimed. There are a lot of people in the healthcare and wellness space who have different and various levels of training. I want to spend a couple of episodes talking to you about the different people involved in healthcare, especially in the United States, so that you can be better prepared and empowered to make medical decisions if you do interact with people in healthcare, if somebody is taking care of you, or if someone is trying to sell you something. Today, I'd like to focus on the people you might interact with in the hospital setting and help you understand or help you read a hospital badge. Every hospital badge on a person working in the hospital or in a medical clinic is going to have their name and their title. And today I want to describe what a lot of these titles are and what some of the training is and what some of their scope of practice is so that you can be empowered to make educated medical decisions. Let's start with physicians. There's 3 categories of degrees that you're going to see after somebody's name who's a doctor. There's MD, DO, and MBBS. Those are the 3 main ones you're going to see in the US. MD stands for medical doctor, and that's a person who has graduated traditional medical school, also called allopathic medical school. DO, which is an equivalent, it stands for Doctor of Osteopathic Medicine. That's somebody who's graduated from an osteopathic medical school. And there's MBBS, which stands for Bachelors of Medicine, Bachelors of Surgery. An MBBS is someone who has graduated medical school from a school in the United Kingdom or in any country that follows the British medical or the British education system. So typically countries who used to be British colonies. MD, DO, and MBBS are equivalent degrees, and in the United States, all of them have to meet the same requirements in terms of testing, training, and licensure. The difference between osteopathic and allopathic medical school is pretty minimal. The main difference is that osteopathic medical school exposes students to osteopathic manipulations, and that involves things that are similar to massage and myofascial release. So it's more of a focus on the musculoskeletal system. Students of allopathic medical schools, or those who get MDs, don't get exposure to this typically in their medical school. Not all DOs incorporate osteopathic manipulations into their clinical practice once they graduate. So once again, MD, DO, and MBBS are equivalent medical degrees. These are all physicians who need to be licensed by a government agency and have to pass multiple standardized tests in order to practice. Medical school is a 4-year graduate degree after completing an undergraduate degree. So you do 4 years of college, you get your bachelor's degree, then you apply for and are accepted into medical school after taking at least one standardized exam that's specific for medical school entry. Medical school curriculums are evolving, but typically half of the time in medical school is dedicated to classroom work and learning basic sciences like human anatomy, physiology, histology, and the like. We spend time in a cadaver lab, understanding and studying the human body, and then 2 years of medical school is dedicated to clinical practice, where we complete rotations, which means we spend a month or several months with physicians in different medical specialties like internal medicine, pediatrics, obstetrics and gynecology, general surgery. Those tend to be the core clinical rotations. You learn about each specialty, you study, sometimes you take exams for each rotation and you get graded on it, those rotations, by the people who are proctoring you during the rotation. At the end of medical school in your 4th year, you apply for residency. Graduating medical school gives you your doctorate. You are now called a doctor, but in the United States, you can't practice medicine until you complete at least 1 year of a residency. After medical school, all MDs have had the same or very similar education. The residency is what makes you or trains you to be a specific type of doctor. In the 4th year of medical school, medical students apply to residency programs. They have chosen the specialty they want to practice. That could be internal medicine, pediatrics, obstetrics, surgery. I chose anesthesiology. The students apply to those residency programs and, if accepted, start additional training that focuses on that specialty. The bulk of that time is clinical care being overseen by licensed physicians. We still do a great amount of studying and book work in addition to the time that we have in clinical practice. Residency programs vary in length, but range typically between 3 and 7 years. They are very intense training programs that require many, many hours to complete. And actually, there's been recent changes to residency programs to limit the number of hours that residents can safely work, because traditionally residents worked, could easily work over 100 hours a week. The reason it's called a residency was, in fact, that originally the almost exclusively men who were doing their residency training literally lived in the hospital. They resided in the hospital, so that's why it's called a residency. After residency, you are now a specialized physician. You can apply for a medical license during residency, and you can practice independently. Some people choose to begin practice. Others choose to specialize further and get additional training. These are called specialty fellowships or subspecialty fellowships, and can range in length from 1 year to many, many years, depending on the field and depending on the specialty. For instance, I'll use the example of a cardiologist. So a cardiologist is someone who has completed an undergraduate degree, did 4 years of medical school, did 3 to 4 years of an internal medicine residency, then completed a cardiology fellowship for about the same amount of time, and is now called a general cardiologist. That cardiologist is a specialist of internal medicine. Some cardiologists do further specialization and can do additional training and fellowships in, for instance, heart failure, where they take care of people who have poor heart pumping and might need heart transplantation. Or they can complete an intensive fellowship learning about the electrical system of the heart and take care of patients who have abnormal heart rhythms or are at risk of, say, sudden cardiac arrest because they might have a genetic mutation that causes the electrical system in their heart to work abnormally. The first type of cardiologist spends a lot of time mostly with patients in clinic, managing medications, and then with heart transplant, managing devices that have been surgically implanted in patients. Cardiologists who are specialists of the electrical system have a clinical practice that could look really different and might be spending a fair amount of their time in an operating room performing procedures on patients' hearts directly. So physicians come in all sorts of shades and flavors. What we have in common is that we have completed an undergraduate degree, medical school. We have done some residency training to become specialized physicians. And we have taken multiple exams, many of them the same, many of them particular to our medical field. We are licensed by a government body and require testing or proof that we are keeping up with current medical literature and data so that our practice is up to date. MD, DO, and MBBS are equivalent degrees. So if you have a physician who has one of those combinations of letters behind their name, rest assured they have been vetted by the same essentially government and academic bodies. Foreign medical graduates, like those who hold an MBBS, are required to take many of the same exams that U.S. physicians take in order to practice. Sometimes they have to repeat training that they've already done in their home country and take tests that U.S. students may not have to take, so they take additional tests. It's a very rigorous process and quite time-consuming. Some physicians have additional letters after their MD or DO or MBBS degree that starts with the letter F, and that means they're typically a fellow of a medical society and demonstrates their involvement with national medical groups and some achievements at the national level of their medical specialty. Let's talk about nurses next. Nurses have the letters RN after their name on their hospital badge. There are two general pathways to receive a RN status. RN stands for registered nurse. One category is getting an associate's degree in nursing, which is typically 2 to 3 years of clinical and hands-on work after high school. The other pathway is to get a bachelor's degree in nursing. And the letters you'll see behind a nurse's name who has a bachelor's of nursing is BSN, a bachelor's of nursing science. A bachelor's of nursing science is a typically 4-year degree after high school. The curriculum includes basic science work in anatomy and physiology and pharmacology. Nurses, like medical students, also do rotations in core medical fields like adult medicine, pediatrics, operating room specialties, post-anesthesia care, and obstetrics and gynecology. In order to practice nursing after getting your nursing education, You have to pass a certification and licensing exam and become licensed by a governing body. Once you graduate from nursing school, you can choose to further your nursing education or go ahead and start working. Nurses come in all sorts of flavors and specialties, just like physicians do. Many of the skills and specialization they receive is from on-the-job training. A new nursing grad may get his or her first job in, say, the emergency room or in the operating room, where they are proctored for an extended period of time, where they learn all of the nuances of that specialty. Some nurses have a clear idea of which fields they want to spend their clinical time focused on during nursing school. Some decide after they get into the workforce. But to become a specialist in nursing without undergoing more coursework, you can become a specialist of particular nursing fields by working as a nurse in that field. And the knowledge and clinical experience that nurses have who've been working in a specific field is, for an extended period of time, can be phenomenal. Some nurses further their education by becoming advanced practice nurses, APRN, Advanced Practice Registered Nurse. There are, again, different specialties of advanced practice nurses. All of them require enrolling in specialty schools, taking additional coursework, taking additional exams, and having a certain amount of clinical experience, either to qualify for the APRN program or during the APRN program. Advanced practice nurses may be called nurse practitioners, who you will interact with in internal medicine or pediatric clinics. They are also found in the operating room as certified registered nurse anesthetists, who are part of your anesthesia care team. Advanced practice RNs or APRNs have to be tested, checked, and licensed by a governing body, and also have to keep, just like nurses, keep up to date with current practice. So there's always continuing medical education that physicians and nurses have to take. Some advanced practice nurses further their education and get doctorates. DNP is a Doctor of Nursing Practice. Many, but not all, advanced practice nurses carry this degree. DNPs have a bachelor's degree, most often in nursing, and have completed graduate level work in a specific field of nursing or in addition to their APRN certifications. In some states, advanced practice nurses can work independently. Others require a physician to oversee their practice. But in either case, advanced practice nurses are required to pass certification exams to hold a license to practice from a government agency. Depending on the type of advanced practice nurse, a APRN can examine patients independently, make diagnoses, sometimes prescribe medications, sometimes perform or help perform invasive procedures. PAs are physician's assistants. PAs undergo 3 to 4 years of training in PA school after receiving an undergraduate degree. PA school is separate and unique from nursing school. It is separate and unique from medical school. PAs are considered physician extenders who have focused training and education in history taking, diagnosis, and treatment. Typically, physician's assistants are overseen by physicians and work hand in hand with them. Physician's assistants during PA school get exposure and study basic sciences, just like anatomy, physiology, pharmacology. They get exposure to core medical fields, internal medicine, pediatrics, obstetrics, and gynecology. And they are tested, licensed, and require continuing medical education. You can see a physician's assistant with or without a physician when you visit one in clinic and establish care with a PA. Typically, the PA will discuss the diagnosis and treatment with the physician. If that physician is not in the room with them, then afterwards go over their assessment and treatment. PAs, just like the other medical professionals I've talked about here, can specialize in particular fields of medicine, adult medicine, pediatrics, surgical fields, and the like. They can have varying levels of skills based on their education and clinical experience and based on the models of care in which they work. PAs can work independently or within their scope of practice after completing PA school and taking the exams and getting licensed. Some, just like every medical professional I've talked about here so far, can further their studies and subspecialize and focus their care. Physicians, advanced practice nurses, and physician's assistants often have roles that are very similar, and their jobs can overlap significantly. All of them are trained to do their job safely and work within a clear scope of practice. Becoming a physician is time-consuming, expensive, and requires a significant, intensive commitment. We have had a physician shortage for a significant period of time. Advanced practice nurses and physician's assistants who can work independently or semi-independently provide more access to care in situations where there is a physician shortage. We have all experienced very long wait times to see a doctor, and PAs and APRNs can often deliver care safely, effectively, appropriately, and are a part of, alongside physicians, a healthcare team. So when we talk about healthcare providers, we are often using this term to include the fact that there's a lot more to medicine than a doctor. My personal medical care team is composed of doctors and advanced practice nurses and PAs. My children's medical care team includes physicians and nurse practitioners. All of these medical professionals are taught and follow the scientific method. We follow the same principles of understanding the human body. We speak the same language, and we approach the understanding of health and illness the same way. We are all members of the same system of medicine. And I know I said it was, difficult and time-consuming to become a doctor. I want to point out and clarify that it is difficult and time-consuming and expensive to become a nurse or a PA. Becoming a doctor is just not accessible to many people who want to pursue the field. And that can be a topic on its own that we can discuss in the future. That being said, it is important to point out that while all of these medical professionals provide safe care under the same system of medicine, they are not equivalent training programs. Each of the training programs are specific to the field, and you as the consumer or the patient should be versed in what your provider's degree and training is. So that's physicians, nurses, advanced practice nurses, and PAs. Let's move on. DPT. DPTs are doctors of physical therapy. Physical therapists, at least here in the state of California in the United States, have to have a doctorate of physical therapy in order to practice as physical therapists. Physical therapists are specialists in movement, in rehabilitation, and in musculoskeletal disorders, and also in acute and chronic pain. They work with patients to improve mobility, reduce deconditioning, and they work hand in hand with the medical specialty of physical medicine and rehabilitation, also called physiatry, which is a specialty of medicine that centers on the biology of rehabilitation. Both physical therapists and physiatrists focus on improving patients' function. And it's been really awesome to see some prominent physiatrists and physical therapists becoming advocates for those of us with long COVID and chronic disorders like myalgic encephalomyelitis. So it's always been an important field to me, and one that's been close to my heart, but even more so now that I am sick with long COVID. I remember during my residency working closely with a physiatrist because she was on staff in our pain department, and anesthesiologists were also on staff as pain physicians. And I remember her telling me a piece of advice that I will never forget, and I have actually not always followed, but I really need to. And that is, at the beginning of the year, call your insurance company and see how many sessions of physical therapy are available to you and covered by insurance, and make sure you set a goal for that year to use every single one. It will do you a whole lot of good. I am not advocating graded exercise therapy by saying this. You don't need to go to a physical therapist and expect a exercise program. Physical therapists have a broad range of skills, and a good one, the one that is the right fit for you, is not going to push you past your limits. They can also give you a lot of insight into your body mechanics, which is certainly important for those of us who've been spending, unfortunately, a fair amount of time in bed. Our body mechanics change, and those changes in body mechanics can trigger or exacerbate our body pains. So they'll teach you something about your musculoskeletal system just by looking at you. Physical therapists work in hospital systems, seeing patients who are admitted. They might be consulted to help patients who have acute onset disease like stroke. We often, in my personal experience as a cardiac anesthesiologist, were intimately involved in post-operative recovery of patients undergoing heart surgery, helping them to learn to get in and out of bed safely, and giving appropriate exercises to help their bodies recover. Outside of the hospital, physical therapists might work in academic centers or in larger hospitals as part of rehabilitation centers or pain centers. Physical therapists may own their own clinics and be independent providers as well. To become a doctor of physical therapy requires an undergraduate degree and the completion of a physical therapy program, typically a 3-year program. Physical therapists are licensed registered with a government agency, have to pass standardized exams, and are followed by a academic board or institution, just like the other medical professionals I've talked about here. Some continue their education to specialize after their physical therapy training or PT school. Like the other medical specialties, some will focus on clinical care, others will focus on research. DMD or DDS. A DMD is a doctor of medical dentistry or a doctor of dental medicine. DDS stands for Doctor of Dental Surgery. These are equivalent degrees given by dental schools. Dental school requires an undergraduate degree and the completion of dental school, which is 4 years typically. Dental school has a similar setup to medical school where they have a 2-year basic science curriculum that is actually quite similar to medical school curriculum, and then 2 years of clinically focused coursework. Some dental school graduates complete additional training called a residency, which can vary in length, but is at minimum 1 year. I take my kids to a pediatric dentist who is someone who completed dental school, is licensed to practice general dentistry, but also did additional training in pediatric dentistry. Some dentists become very specialized, and I have worked alongside dentists who are training to become maxillofacial surgeons, which requires a residency that is several years long after dental school and is just as intense as any surgical residency. So you'll often find a dental fellow working with the ear, nose, and throat surgeons or the neurosurgery trainees. Dentists also require testing, licensing, and continued medical education, just like every other field I've mentioned. PharmD. This is a doctor of pharmacy. Doctors of pharmacy are pharmacists. They complete generally a 4-year graduate program after obtaining a bachelor's degree, and they're experts in pharmacology. This means that they also have to be experts in chemistry and in human physiology. Pharmacists often work in hospital settings and are particularly important members of the ICU staff and especially the organ transplant programs. They have expertise on how medications affect specific parts of the human body, especially when there is a disease process affecting that body. Every order I prescribe as a physician is checked and verified by a pharmacist. They are critical members of the medical system, and their scope is well beyond a drugstore where you might be picking up your prescriptions. PhD. PhD stands for Doctor of Philosophy. The degree of PhD doesn't tell you a whole lot. You need to know what the PhD was in and where the PhD was obtained. PhDs can be offered in social sciences and in what we call the hard sciences, like biology, physiology, physics, and so on. PhDs are intensive graduate level degrees that involve a research component. In the hospital, you may find physicians who have MD, PhD on their badge, which means that in addition to medical school and residency in their field, they also did and ran a research project for several additional years, and they are what we call physician scientists. MD PhDs may have an exclusively clinical practice. They may exclusively be researchers who you will not run into in your life as a patient, or they might have a balance of both. MD PhDs who work clinically are great resources to ask about research studies in a variety of fields. These are the people you might want to bring a journal article to that you'd like to understand a little bit better. They are experts at that. So it's a resource to you if you have a provider who has a PhD. Other titles you're going to find on a hospital badge include the following. MA. MA stands for medical assistant and is a person who's trained to assist physicians. This person can take vitals, administer injections, review your medications and allergies, and sets you up for your visit with your doctor. CNA is a certified nursing assistant and is a person trained to assist nurses. CNAs focus on direct patient care tasks like bathing, dressing, and eating. They are a critical part, especially of the inpatient hospital system. There's a category of staff that are variably referred to as patient care assistants or orderlies, sometimes called transporters. These are a group of people who are focused on your physical safety. They will help transport you from one location of the hospital to another, from one bed or chair to another, and will help bring you items that make you more comfortable, like food and blankets. In the operating room, they play a vital role in ensuring our patients are where they are supposed to be and ensuring that supplies are stocked and available to those who need them. This is a group of individuals who may or may not be licensed by a governing agency. They often get on-the-job training, but they're certainly vetted, and many of them have certifications that reflect their training and competency. There are also RT, respiratory therapists, who work hand in hand with pulmonologists, with anesthesiologists, particularly in the operating room and ICUs. They are experts in mechanical ventilation and all sorts of techniques and devices that help patients breathe and ventilate better. They have specific training, they are licensed, they need continued medical education, and they're really experts in respiratory physiology and in a lot of ways in chemistry as well. Respiratory therapists are absolute heroes. At the height of the pandemic till today, they are literally on the front lines of respiratory disease and take care of patients who are intubated, mechanically ventilated, or require assistance in breathing. Technicians abound throughout the hospital and are experts in the devices that we use in medical care. I work very closely with anesthesia technicians who have expertise in the machines that we use to ventilate patients and administer anesthetics. Surgical techs work with surgeons in the operating field, ensuring that the tools are sterile, the tools are appropriate, that the patient is safe, and that the risk of infection is low. Surgical techs become experts in surgery, quite frankly, and can often anticipate what a surgeon is doing or is going to do before the surgeon can even vocalize it. Technicians may or may not be licensed. They typically have certifications and have to pass certain exams in order to maintain safety in their field. Social workers are also an important part of the typically hospital setting. The most common titles you'll see on a social worker's badge is MSW or LCSW. The first stands for Masters in Social Work, and the second is Licensed Clinical Social Worker. All have a master's degree in social work. The LCSW requires additional licensure that is in addition to the master's degree. Social workers in the hospital are very important members of the healthcare team, helping patients and their families cope with diagnoses and treatments, and also help them access and utilize resources that might be available to them, and to make sure that when they are discharged, they have resources that they need and that they are safe. Social workers can also help coordinate care, but patient care coordinators are not always social workers. Patient care coordinators can often be nurses, but they have various backgrounds. A patient care coordinator is sort of like a mediator, or someone who can take a look at your chart and integrate all of the recommendations from different specialists when your care is quite complex, and help you navigate the medical system as best as you can with, say, the insurance that you might have, and help you talk to different members of your healthcare team to sort of streamline things, basically, so they can be really, really helpful members of your care team. You may have a patient care coordinator available to you through your health insurance program or through the hospital institution at which you receive care. The last field I'll talk about is a registered dietitian. Registered dietitians work in hospitals and in clinic settings to help patients meet their caloric and nutritional needs. Registered dietitians are different than nutritionists. Registered dietitians have educational requirements that someone who calls themselves a nutritionist may not have. An RD will have at minimum a bachelor's degree in nutritional sciences, have done an internship, which is about a year long, but can range a little longer than that. And then they take a certification exam to become a registered licensed dietitian. So those are the most common letters you'll find after somebody's name on their hospital badge. Let me know what I've missed. Let me know if you have a combination of these letters on your own hospital badge and what brought you to this podcast. Reach out to me. My email is longcovidmd@gmail.com, and you can find me on Twitter/X at Dr_Zeest, DOCTOR_ZEEST. I love all your feedback, and I always look forward to reading your messages. Next week's podcast will continue this theme, and we'll talk about other specialties in medicine and the wellness space, including complementary medicine. Until then, this has been the Long COVID MD podcast. I'm your host, Dr. Zeest Khan. I hope you're feeling well today, and until next time, bye for now.